Okay. Well, we have an hour together, so without further ado, I think we'll get going with the program and welcome everybody back from the break. Good evening and welcome to the LAM Foundation's third day of giving and a very special panel discussion tonight called LAM Science: How Patients Fuel Momentum. I feel like I need to put a disclaimer out here right now that as I look at my notes and the things that I wrote to say, and I reflect on the last hour and 15 minutes that we spent together in the cocktail hour, you all essentially said everything I was going to say. So it's going to seem like I didn't have any creativity, but the fact is, I think it's what we all think about when we're together at events like this. So anyway, I did write it ahead of time, even if it doesn't feel very original. So I'm Sue Sherman, Executive Director and Chief Executive Officer of the LAM Foundation, and I am delighted to be with you and our distinguished panelists tonight. Our program is now the highlight of our 2023 Day of Giving, and this is, as you know, our most important fundraiser of the year. It was born out of our Breath of Hope Gala that has always been a traditional part of the International LAM Research Conference and LAMposium. And during the years when we aren't able to be together in person, we host the Day of Giving. And let's see if I can get my slide to change here. Hold on a minute. There we go. It doesn't matter whether we're in person or not, virtually or together, the goal remains the same, and that is to raise as much money as possible for LAM research. This year, we hope to achieve one of our highest goals ever, which is $500,000. And the panel discussion tonight is actually going to talk about how some of the ways that we use these funds to invest in hope and in the future of LAM science. So before we welcome our speakers, I want to review a few housekeeping items and the flow of our time together. I'm just going to spend a few minutes sharing my introductory comments and a few slides to provide context for our discussion. And as I mentioned, I think we have context from the last hour together. From there, we're going to talk with our panelists about how LAM patients have influenced both their research and also their clinical care. For the balance of our time, at that point, we'll shift to questions that were submitted earlier, and we've queued those up. So we hope to answer as many of the questions that were submitted by the LAM community as we can. And I want to thank everyone who sent in those questions ahead of time. We are going to keep the chat window closed during the presentation so that we can follow our format and keep microphones muted for background noise. If in fact we get through all of our pre-submitted questions, we'll open up for chat and see how much more time we have together. So thank you for those housekeeping notes, and let's begin. So I want to start by setting the stage for our conversation tonight by shining a light on a secret. I guess it's not really a secret in the LAM community, but it's something that our panel members brought up almost immediately when we started to plan our discussion tonight. That something is what we all know if we've attended a LAM research conference and LAMposium. It's something that foundation staff, volunteers, board members, liaisons hold very close to their hearts as magic. It's been ingrained in the foundation from the very beginning and planned actually quite deliberately for the last 28 years. And in fact, I think the secret is so well known that if I asked every one of you on the call, what is the one thing that makes the LAM community so special? What is the secret sauce, as we sometimes call it in our meetings? I'm pretty sure each of you would have the same answer, or some version of the same answer. And that is that the secret sauce happens when we all come together. LAM scientists, both established and young investigators, clinicians, women with LAM, and a few men through the years, family members, loved ones, caregivers, when we're together to meet, talk, and bond. at Lamposiums and regional meetings, support groups, and virtual events, and even what just happened over the last hour and 15 minutes. This community comes together to share stories, talk about your challenges, celebrate your progress and advancements, and also lament heartbreak and difficulties. There's an immediate and powerful sense of understanding, and we talked about this just an hour ago, that often leads to lasting friendships, lifelong friendships and connections. There's also something bigger that happens when we're together, especially when women with LAM and even family members make that unique and irreplaceable connection with a scientist or a doctor. Time and again, we've all witnessed how these spontaneous exchanges can shift a researcher's perspective, can inspire a new question, can alter a clinician's plan of care, or even ignite a whole new line of questioning. I think many of us remember that happened around 2017 when we were planning the patient benefit conference. And then in the survey, there was this repeated question about fatigue and feeling so tired, and that has led to a new avenue of research. This is our secret sauce, and it is the one thing that really works for this community and the thing that we want to explore with our panel tonight. So to help frame the discussion and move it from these images that we know from our meetings together and our virtual conferences, created a graphic. It's a kind of a simple graphic and called it the LAM Research Continuum of Discovery. And it's a way of showing how together this community has continued to generate new and different LAM research over the last nearly 3 decades. So as you know, the top left section represents our LAM scientists around the world who are pursuing innovative basic and translational research. We'll meet a couple of them in a few minutes. They're looking into genetics, cell biology, metabolic pathways, looking to find new and better animal models, always searching for the next and better biomarkers. The LAM Foundation funds these scientists. We've already given away more than $12 million through the years through fundraisers like has been going on all day today. And another $6 million to produce the research conferences and activities that connect our scientists and our community. When they're successful in finding a new potential therapy, then we move over into the clinical translation portion of the model and clinical trials. And as Beth Brown and Claire Child talked about on our call earlier tonight, we have, through the years, assembled an educated and enthusiastic patient community who courageously volunteer, sign up, and participate in clinical trials and surveys. As a small rare disease community, you have powered an impressive number of clinical trials and, oh gosh, generously filled out survey after survey after survey. Our clinic network, which is now 72 sites around the world, help facilitate the clinical trials. And they also bring more patients together to talk about collaborating on care, learning about the disease, finding the barriers to diagnosis that comes up a lot, as well as the limitations of sirolimus and some of the therapies that we have for some of you. Lastly, and most importantly, is what we've been talking about, the real world LAM experience. And as we continue to learn more about LAM and more patients are connected to this community, you all keep providing valuable insights into this devastating disease. So we learn from you, and again, you're going to hear more tonight. We have to keep finding the next question. Why only women, and what's the role of hormones? You've asked, what about nutrition? What about exercise? How do we have better supplemental oxygen? This again came up earlier. What are my options for having a family, you've asked, and why am I so tired, as we mentioned? Another big question is, when will we be ready to be able to repair damaged lung tissue so that we can reclaim the lung that has been lost to this disease? When you share your stories, the circle comes fully around, and we now start again with new lines of investigation. So it's one thing to talk about a pretty graphic in a two-dimensional PowerPoint slide. And let's now bring this thing to life and ask our panelists to describe how the power of our secret sauce has directed their research and influenced the clinical care that they provide. Please join me in welcoming our panelists. We have Doctors Carmen Priolo, Dr. Dan Dilling, and Dr. Marina Holtz. And since I've been speaking so long at this point, what we've asked them to do is introduce themselves so that they get a little bit more time to talk and tell us about their journey with LAM. And I'm going to see if Julie can spotlight our speakers. There they are. Excellent. So welcome to all of you. And I will begin with Dr. Priolo. Would you like to start us off?
Of course. Thank you, Sue, and good evening, everyone. First, I would like to say I feel truly honored to take part in this event. The cocktail hour has been special as every occasion when the LAM community comes together. I'm Carmen Priolo. I am an assistant professor of medicine and a research investigator in the Division of Pulmonary and Critical Care Medicine at the Brigham Women's Hospital and Harvard Medical School in Boston. My laboratory is focused on LAM and TSC research. I have studied LAM for over 10 years now, and I have attended every LAM research conference since 2011. I have received 3 research grants from the LAM Foundation. As a background, I have a clinical training in medical oncology, which I completed in Italy, where I grew up, and the research training in cancer biology and metabolism, which I completed in Boston at the Dana-Farber Cancer Institute. I, at that time, was focused on prostate cancer and other gender-specific and hormone-dependent disease. And then I joined Brigham Women's Hospital and the Center for LAM Research and Clinical Care, directed by Lisansky at the Brigham Women's Hospital, and then initiated my LAM research. On the personal side, I'm a proud mother of a 5-year-old boy, Francesco. He just turned 5 on Sunday. He's very curious about what I do, about what we call the magic of science. So we talk a lot about science in a way that he can understand at home. And I would just like to conclude my introduction with a little note about my secret passion, which is music. And I played classic piano for many years. But when I started my own lab at the Brigham, I also started learning jazz improvisation, and I started playing with a group of musicians. And they found a really striking analogy between jazz improvising and studying a rare disease like LAM. Both require tremendous passion, creativity, but especially feedback and continuum between parts, either musicians or researchers. And I think this is exactly what we experience doing research within the strong community as the LAM community. We inspire each other. And with that, thank you for having me tonight, and I look forward to our discussion.
Excellent. That was fantastic. Well, number one, I think we're already recruiting our entertainment lineup for the next Lamposium. So thank you for that. And it's very interesting that you moved from 100% male disease and prostate cancer to the other end of the spectrum with on nearly 100% female. Thank you, Dr. Priolo, for joining us tonight and for sharing. Dr. Dilling, how about you up next?
Hi, so glad to be here. This is a really inspiring night, and like was said already, the cocktail hour really whet our appetites for trying to do something great tonight. My name is Dan Dilling. I work at Loyola University Chicago. I'm a pulmonary and critical care doctor, so a pulmonologist, and I have been in practice for, oh gosh, about 17, 18 years now. It is, I have a career that mixes advanced lung diseases and rare lung diseases like LAM with lung transplantation. And so I think that's part of my, I guess, special angle or talent that I bring to the table within the foundation is my knowledge and focus on transplantation for all things, but specifically with LAM. I'm a professor of medicine at the Stritch School of Medicine there as well. So I've been working with the LAM Foundation as a clinic director for, I think, about 12 or 13 years now, and built up a really large clinic that we serve states around the Midwest, Indiana, parts of Indiana, Michigan, Wisconsin, Illinois, of course, Iowa, and a few people from elsewhere. So I've over time really come to appreciate the input of the LAM patients into not just their care, but ideas about what to do next in the science arena, or what problems are most challenging to them that need to be looked at in research. I also have had other roles with the LAM Foundation, and currently serve as a member of the board of directors, and for several years have been like the medical director of what's called the Circle of Hope program, which is a program focused on trying to assist LAM patients who are facing questions about future lung transplantation or waitlist, or even recovery from the transplant, as well as some things about coordinating sample collection that I think we'll talk about a little later. I also take care of patients with other advanced lung diseases like pulmonary fibrosis and cystic fibrosis and some others. And I enjoy sort of being able to learn from one patient community to the other what works best. And of course, what the LAM patient community is doing is always what works best. It's really been inspiring, I think, to many other communities. In fact, one of my other medical societies is exploring the possibility of incorporating patients in a way that they never have before. And I've certainly pointed the finger at the LAM community, and I'm going to be chairing a task force trying to help understand how patients might invigorate and influence the workings of a true medical society. So it's not a patient advocacy organization. So the patient voice is so important. On a personal note, I live in the city in Chicago, and I'm parent of twin freshmen of high school. And so that's been quite a transition this year, sort of seeing these kids start to grow up and their eyes open to new things and meeting all kinds of new people. And of course, it's wonderful, but it's hard to watch them grow up this way. And I really like music too, but I don't play a lick of music. I'm a big fan of live music, and I make every effort every time I go to another city for a meeting or a vacation or whatever to see what band might be playing in one of the clubs or stadiums or something, and just about froze my my butt off at a show in April in Denver at Red Rocks, where I'd always wanted to go and finally got to go. And it wasn't for the band, it was for the venue in that case, but it was actually snowing during the show, so that was something to see. Anyway, it's great to be here, and you all inspire us. So thank you for all your attention, but especially thank you for your support to make this happen and to fund the next generation of researchers and the next big thing that's going to come.
Awesome. Thank you. So you're going to leave us hanging with what band you froze your butt off seeing?
That was a band. So I'm not really into this type of music, but it's like called electronica dance music. And so this was a band called Sophie Tucker, which was very entertaining, but half the entertainment was watching the people that were there to watch that band. But it was mostly about the venue. Red Rocks, if you don't know, is a natural amphitheater outside of Denver, and it's just carved into the rocks of the foothills of the mountains, and it's spectacular.
Well, thank you for sharing and for all your information, and for the many hats that you wear on behalf of the LAM community. I feel like we tap into your expertise nearly every week, and we're grateful for that. Okay, let's move now to Dr. Marina Holtz.
Hi, hello everyone. I hope you can hear me. My audio equipment fails me every day.
We can hear you.
All right, that's great. Good. So my name is Marina Holtz. I have several jobs. My day job is Dean of the Graduate School of Biomedical Sciences at New York Medical College, right outside of New York City. I am also a professor of cell biology, and I have a lab where I do basic science research. I have two research directions, both focusing on diseases of women. One is breast cancer, so very common disease, unfortunately. And the other direction is obviously LAM, so the rare spectrum of diseases of women. So in my research, I like to integrate lessons from what we know in breast cancer and apply them to LAM, because there are a lot of similarities in terms of the role of hormones, as well as the metastatic nature of the disease. And then I'm also very much interested in clinical translation. Many of you participated in the RESULT trial, which was the trial of resveratrol together with sirolimus. So I like to take some of the basic science lessons that we learn in lab and apply them to the clinic as much as possible. And again, just as Dr. Dilling said, some of the things are only possible with the LAM Foundation, because let me tell you, it's extremely difficult to start a clinical trial in any kind of oncology indication. I was very fortunate to have many of you who participated so avidly in research studies and contributed to advancing our knowledge. I am also a public health researcher, and you'll hear a little bit more about this later on in the evening, but I'm interested in patient outcomes. One of my projects is here with the LAM Foundation, which is called LAM PrEP, Patient Research Priority Survey. We will really want to talk to as many of you as possible to find out what is important to you to advance your health needs, so we can align our research program with the priorities of you, all of you here on this call. So again, I'm very fortunate to do something like that is only possible with the help of the LAM Foundation. My other role is I'm a member of the Scientific Advisory Board. So I'm one of the people who reviews the grants that come into the LAM Foundation, and I chaired the panel a few times, which was really, really interesting and really important. And again, as part of that work, we see the different kinds of science that different researchers and clinicians are interested in, and really want to align that as much as possible with real needs of women with LAM. I'm also a funded investigator. I received my first grant over 10 years ago, and I still remember, like some of you remember the birth of your children. I remember when Frank McCormick called me to tell me that I got the grant. I remember the exact spot in my house where I was. So ever since, I've been coming to the Lymposiums and participating and interacting with all of you. So that was really a highlight of my career, to be honest. I don't do too much for fun. I don't play any musical instrument. I have two children in high school, a freshman and a senior. So it's kind of busy, the spectrum of high school. I am an avid skier, and unfortunately, right at the end of last season, I fell and tore my ACL. But then the next day I participated in one of LAM panels. So I'm not responsible for anything I said that day.
Thank you very much. Yeah, stay off the slopes, and yeah, wait a couple days after you're under anesthesia for a meeting, right? Well, maybe there's a lesson here as we listen to all the things that our panelists do for the LAM community, that feeling of love and support and connection flows both ways. And once you, I think, experience it, there seems to be a tendency to want to do more. So we thank you all for that. Let's move on to a couple of our questions, and we can continue in the same order, or we can change it up. But really wanted to revisit our secret sauce discussion from earlier and ask if perhaps each of you would give an example of how meeting a LAM patient or a family member maybe inspired your thinking or your research direction, or whether it might have had an impact. So Dr. Priolo, do you have a few thoughts on that?
Yes, I actually have a personal story related to LAM, talking about how inspiring LAM women can be. And so it was my first LAM symposium that I decided to focus my career on LAM research. As I said, I was working in prostate cancer and metabolism and cancer metabolism. And my clinical training was on genitourinary oncology. Then in 2010, I met Elizabeth Tensky, and she talked to me about LAM. And I knew very little. I knew very little about LAM. It's a rare disease, and we don't learn much in medical school. So Lisa, so was my very first connection to LAM. She invited me to attend the LAM symposium in 2011 in Cincinnati. And so at the conference, I had many interactions with women with LAM. There's over 200 women with LAM at once, many under the age of 40. I talked to them, to their family, and that really triggered in me that desire to answer their questions. There were so many questions. And the questions were, how does these LAM cells proliferate through the lung, infiltrate the lungs, destroy the lungs, and even metastasize to other organs such as the kidney, the uterus, the lymphatics, and so on. And so how can we improve the lives of these women with LAM? How can we monitor the disease? And so all this big question will take many careers to find the answer, but I decided to invest my own career on LAM research, and set my career-long research questions. And so the night after the conference, I was talking to my mom, who was in Italy, and I told her about the LAM and the conference and about my decision of really focusing my research career in my lab on LAM and TSC.
Fantastic. We just need to keep inviting more scientists to our meetings. Right. Dr. Dilling, any thoughts on the secret sauce in your clinical practice?
Yeah, so it's funny the way Dr. Holtz described the phone call from Frank McCormick, because I was going to talk about something very similar. So I was young in my career, maybe 15 years ago or 12 years now, something like that. And I cared for a couple of women with LAM at that time. And it was really with my hat of lung transplant on, because these were women that were referred to us and under my care for seeking a lung transplant. But gosh, I had curiosity about the disease and the best way to treat it. And it was before sirolimus therapy was a regular thing to do. And, I just had all kinds of questions. And I remember calling Frank McCormick and, sort of bounce some things off of him about it all. And he was very helpful, and I think glad to learn that there was someone interested in Chicago, because I can remember the day I got a call from him. I can remember the spot in my hospital where I was standing when I got a call from Frank McCormick saying, we're setting up these LAM clinics across the country and across international too, but at first it was just across the country. And we're going to need somebody in Chicago. It's a big city. So would you be interested in sort of getting more involved and getting, starting a LAM clinic at your hospital? And I was surprised and delighted, and I know I was happy. And I said yes. And I think it started me on a different path than I was already on. I mean, I think that my work in the LAM clinic and with the LAM Foundation and research around LAM has sort of put me in a different place than I would have been. And of course, it's a two-way street. I've I think helped a lot of people, and I've been helped by being able to have this as a special part of my life and my career. I've always said that when I get a notification that there's a new appointment being requested for a woman with a new diagnosis of LAM, that it becomes something I very much look forward to, so that I can try to give help in whatever way I can. And as someone said during the cocktail hour, they were surprised by the way the appointment got prioritized. And that's the same way we do it. So because I really want to make sure that we get them in and help them and teach them in whatever way we can as soon as possible, because there's so much angst involved in that first month or two that you've learned that you have or might have this disease. So anyway, yeah, it's been a wonderful experience to be a part of this community and in the LAM clinic, and really enriched both my career and my soul.
Thank you for saying that. Sticking with the LAM Clinic Network for a minute, I'm sure the number of LAM patients in your whole practice is a small number, right? Which is probably the case with the 72 locations around the world. How do you see the clinic network helping to advance guidelines and care, and how is it that that group of international and national clinicians can help improve what's the care and diagnosis that patients are getting?
Mm-hmm. So we talk a lot about the research mission of the foundation, and gosh, that's super important, and finding a cure is the most important thing. But there is more to the foundation than just research. And we all are aware of the learning opportunities from the Lymposium meeting or webinars and those things that and just the features on the website that help us learn stuff. But the LAM clinics are yet another aspect of it, and it's a place. These are places that can bring expertise into a region. You can't gain expertise without having a volume of cases. Yes, it's a minority of all the patients I see, but actually I'm caring for well over 100 patients with LAM, so it's not an insignificant part of my own practice. But with that said, it's a place where expertise can come together, and it's not just the doctor, it's not just the pulmonologist, it might be the surgeons that are there, it's the radiologists that are there, it's the nursing care, it's the pharmacist, it's a whole team of people, and it's training the next group of people too. There are fellows that I've worked with that have done research in LAM or clinical care in LAM and are caring for patients with LAM in other facilities now. So it's a place to not only focus the care and gain and build expertise, but pass that expertise on to the next group of people. So that's what it does for the hospitals. But of course, for a patient who comes perhaps a bit boggled in the mind because they've heard about this dire prognosis, or they've visited the dark places on the internet that say have old or incorrect information about prognosis in LAM. It's really heartwarming and satisfying for me to be able to give real information and the right advice, and help bring someone off the ledge of anxiety about a disease that they don't understand, and to have them leave the clinic appointment feeling peace, and for the first time perhaps in weeks or months. And it's just so rewarding. And it's sometimes as I'm closing the door of the room, you can hear the beginnings of that conversation between husband and wife or mother and daughter or something, and just about how relieved they are that they've learned something different than the dark things that they thought they were expecting to hear. So I think the LAM clinics are so important. We've now got 38 of them in the United States. The most recent one in Charlottesville, Virginia. So that's very exciting. We now have 34 of them outside of the United States, including the most recent one in Mainz, Germany. And they're all across. They're in every continent. Other than Antarctica, they're in every continent across the world. And we need more. We need to find the nooks and crannies that where people still need to benefit from this focused care and this great resource that comes from the LAM clinics, all supported by the LAM Foundation and the support of the staff and donors.
Right. Exactly. And one of the things that I hope everyone on the call realizes, it's a role that the foundation is playing more and more as health systems are larger and more confusing and more complicated. Sometimes patients will see a LAM clinic on our website and call and maybe get stuck at the front desk, if you will. And we've been able to help facilitate more and more appointments quickly, in large part due to the relationships we have with our clinic directors. So sometimes if folks are our community on the Facebook pages or whatever can share that the foundation is able to actually help expedite appointments. That's simply because we've cultivated these relationships.
Yeah, it even happens in my own center. You know, if you call our central scheduling and somehow the person there just maybe doesn't know the intricacies of my practice, and they very well might not. It could look like a very long wait list time, and I somewhat frequently get a call or an email or something from the staff at the foundation saying, hey, can you help inch this one up? And, you know, instead of a couple months, it becomes a couple of days. So it is the intervention of the foundation.
Right. Excellent. Thank you. So Dr. Holtz, I think in almost one sentence, you talked about basic research and patient outcomes research. And I wonder if you could talk a little bit about that, because you kind of covered the entire pink diagram there with that. Would you share with us how that happened and what you're excited about with this research?
Yeah, so that project came from my experience on the scientific advisory board and being part of the grant review panel, where we receive many interesting, exciting types of science, but we always ask, is this directly relevant to patient outcomes, patient care? Will this advance or make a breakthrough in the near or even medium term? So what we wanted to do is to ask patient what is important to them and what kind of research priorities are the ones who what they think will advance their health needs. So this project is called LAM Prep, Patient Research Priority Survey. And what we are doing is we're doing patient focus groups with groups of patients. We have conducted 2 focus groups so far, and one is coming up where we just have conversations in sort of like a cabaret style setting where we all sit around tables and we just ask questions about what is important, what could improve your care, what are the unmet clinical or medical needs, what would be the breakthrough that you would be most excited to fund. And we get really amazing answers from the women in the room, as well as their caregivers. And caregivers are their partners, their children, their parents who come with them and support them. And they have a completely different perspective sometimes on that, which is also very valuable. In addition to in-person focus groups, we are planning to conduct 2 virtual groups for those of you who could not travel, because we really want everybody's voices to be heard. And after we synthesize all the answers, our goal is to deliver a community-wide survey where everyone can rank the research priorities, so we can really determine what is important to the entire community of patients, physicians, clinicians, providers, and scientists in order to really prioritize our research program in a way that will benefit the patients the most.
Fast forward 2 years from now, and we have the results of your research. What do you hope will happen?
We're hoping that we'll be able to customize our research program to create funding opportunities that will attract researchers from other fields that can bring relevant expertise, perhaps in longer generation. That's something that came up. Maybe engineers who can create better oxygen delivery systems, something that is light and portable, something that everybody wants. So really to use this as an opportunity to broaden our research focus, as well as narrowing it towards things that are really important to the patient community.
Very exciting, very exciting. Also another LAM Foundation funded project. Well, we do have some questions sent in from our community, but I wanted to make sure we circle back to Dr. Priolo related to your ongoing research right now. Did you want to describe a little bit more about what you're currently working on and what you hope it will reveal?
Of course. So what we try to incorporate as much as possible is exactly that continuum that you have shown. So incorporating basically bedside question into the bench research and then going back to the bedside. And so when I started working on LAM, the career-long questions that I've asked is, how can we leverage LAM cell metabolism to identify biomarkers of LAM? And why these questions? Because at the LAM bedside, and I think Dan can even comment more on that, we learn about the need for a quantitative or non-invasive indicator of disease burden, which can be really useful in new and future clinical trials where we want to compare a new drug, for example, to rapamycin, or a combination of rapamycin of a drug with another one, against a single agent. Or in another situation when we would like, for example, to have a predictive factor of LAM disease progression. It means that would really enable us to move towards a more personalized medicine. And so, given my passion and my background on cancer metabolism, I try to apply this concept to identify potential biomarkers for LAM. And so there were two grants, two funds from the LAM Foundation that really made that possible to the point that we are now running a metabolic imaging clinical trials for LAM. So the first one was a biomarker grant. There was a meeting, the first LAM biomarker meeting in 2014, I think, when we all met and discussed what are the big questions right now for LAM. How can we improve the lives of LAM patients, of women with LAM? And so my proposal was to use a metabolic imaging biomarker, a technology which is called positron emission tomography, or PET, which is very well known in oncology. But my proposal was to identify a novel tracer, a novel dye to be used with this methodology. What is PET is a series of images taking of the entire body, and the radio-labeled nutrient, which could be any nutrient, is injected through the vein and can then reach and accumulate cells, organs, tissues that really like to take up the nutrient. And so the idea was, if we identify the nutrients the LAM cells really like, then we might be able to track them as they accumulate into the LAM lesions. And that could be proportional to the amount of LAM cells that are present in the lesions and in different organs. And then if we get a quantitative measurement assessment of these nutrients, then we will be able to have a quantitative assessment of LAM disease burden across the body of a woman with LAM. And that number could change over time if the disease progresses, to decrease over time if a new therapy is tested, or if rapamycin is effective in getting rid of the LAM cells. So this is the very basic concept that we tested. And thanks to the biomarker grant in 2014, we were able to do a first preclinical study, and we identified a few nutrients that can be used for novel modalities of PET, so not the traditional modalities that are currently used in oncology. And starting from that in 2018, we met again on the patient benefit workshop, where we discussed with LAM patients and with LAM physicians and other researchers. And again, we reassessed what are the priorities. And it was at that point that we received another fund, the patient benefit fund, that actually made the clinical trial possible to test acetate PET in women with LAM. So we have the trial open. We have already started imaging patients. We are enrolling more patients, and we hope to complete the trial in the next year or so. And I look forward really to seeing the results and to be able to get feedback from all colleagues and see whether that could be a potential valuable biomarker that can be used in future therapeutic trials of LAM, or being incorporated in the clinical practice as a predictive biomarkers of LAM progression and response to therapy. So I'm immensely grateful to the LAM Foundation, to the community, and to LAM patients especially, because they're so willing to not only share their needs and they're being so resilient, but also to participate in our research. And this is absolutely precious and unique, I think, to this community.
Wonderful. Well, two quick things. I mean, we've been talking about biomarkers for years, right? It's potentially be the game changer, as you said, for determining or measuring the effectiveness of a possible new therapy, less invasive, maybe more accurate than the PFTs that we have now, right? So do you want to say just a couple words for anyone who has in the New England area who might be able to participate in this trial? Who are you looking for?
Yes, so we enroll LAM women who are either rapamycin naive, so never received rapamycin in their life, or they have been under treatment with rapamycin, continued treatment for up to 5 years. So these are the current criteria. So because the lung is more difficult to image, that there are no modeling, we are generating models to analyze the lungs. And so we use at the same time the renal lesions, the renal angiomyolipomas as an endpoint, as a primary endpoint for the trials. And so one of the criteria is to have at least one renal angiomyolipomas that we can use as a reference in our study. So it is a simple study, and anyone who's interested, please feel free to contact me directly or the LAM Foundation. So we can talk to you more about the study.
Thank you. Congratulations. Very exciting. Okay, so as always, we have so much to talk about and never enough time, but I'm going to shift very quickly to a few questions that were submitted. And I'm going to encourage all of our participants to write down your questions and email them to us, because I know I'm coming up with a lot of questions myself, and we'll do our best to follow up after tonight's conversation. So this one I think goes to Dr. Dilling. The question is there any research or anecdotal evidence that suggests that any lifestyle or dietary choices can slow the progression of disease or positively affect patient outcomes? You are on mute.
All right, thank you. You'd think after 4 years of this that we'd get used to it, but no. So this is a really common and also I think a very provocative and interesting question that comes from patients and loved ones all the time in clinic. As for slowing the disease, I'm not aware of any specific diet or lifestyle modification that could affect the disease, other than perhaps not smoking or not smoking anything. In fact, that might be one thing, a lifestyle modification if it's one of your habits, but not the case with most people with serious lung disease. But I would say that exercise and being fit and living a general healthy lifestyle is good for anyone, and particularly someone with an underlying lung disease. Some of the work that's been done that we heard about at the cocktail hour from the folks in Seattle is opening our eyes to maybe some of the ways that specific activities or specific types of exercise might be good for people. It helps mind, body, spirit, I would say. And it helps by being in good shape and, sort of in a regular exercise routine. You can learn to overcome your limitations and maybe adapt to some of what your limitations might be. But perhaps we will learn something different someday about diet or some other activity or lifestyle change. And it's always patient ideas that leads to research that unlocks new knowledge that changes the answers to these questions. So, of course, it's always important for us to listen to what patients are talking about to help move the field forward. And thanks to everyone for speaking up and asking questions like that.
Very, very important topics. They've come up a lot in our other research. Any other comments on that from the other two panelists? Okay. Another question from the community, probably with your breast cancer familiarity, or the other two of you as clinicians. Is there any evidence to suggest that a hysterectomy would slow the progression of LAM? And what are we learning about the role of hormones in LAM? And any thoughts about where we're headed with future research? Who would like to volunteer for that one?
I can start. I've actually been asked that question a bunch of times in recent months, and I think this is all coming on the tail of some work that was done with semi-new technology, single-seq RNA analysis, where we've learned from the RNA signature of LAM cells that they resemble somewhat uterine cells, and which really raises a big question about whether the uterus might be a source or somehow a part of the story of how this all comes about. So would removing a uterus make sense? I mean, there's some logic there that makes you wonder about it for sure. But I think in the absence of any like true information that hysterectomy influences the direction of the disease, I think I would be unlikely to recommend it if there's no other reason to have a hysterectomy. I'd be unlikely to recommend it without further information at this point. That said, if the more we learn, the better. And little patient story, I have a patient with LAM that I care for that needed a hysterectomy for painful fibroids and some bleeding issues, and so she was going to have she was going to have a hysterectomy and wanted to make her experience as useful as possible, I guess. So I said, let's try and coordinate donating your uterus to research. And it was complicated because it was being done at a different hospital, and we had to get her doctor on board and the pathology department on board at that hospital. And the LAM Foundation was central to helping to make some of this possible and coordinate it, just as they have been in coordinating the donation of lung tissue with patients that are having transplants. And so hopefully we'll learn more about this and be able to answer this question with a more definitive answer. But in the absence of more information, it's a real surgery, and complications sometimes happen from surgery, and unless you had clear evidence that it does something good, I don't know if I could recommend it at this point. But I welcome other opinions or thoughts or questions.
I see our other panelists nodding. Any thoughts, additions?
I absolutely agree.
It was just I remember a study from, I think, Dr. Joel Moss at the NHLBI published maybe 10, 12 years ago, just somehow confirming what Dennis just said. I think they looked retrospectively at women with LAM, a large cohort, like more than 400, who had received hysterectomy, and they wanted to look at the prevalence of leiomyomas, but they also looked at lung function, and they compare women who received hysterectomy versus women who did not receive hysterectomy, and they think they did not find retrospectively any difference in lung function and disease progression. So that was probably the closest to give an answer that I think is available. I don't know about more recent literature, but I think that really supports what Dr. Dilling was suggesting.
Great, thank you. Dr. Holtz?
Yeah, I just want to add that I agree completely. And based on what we know from other metastatic diseases, even if the cell of origin for LAM resides in the uterus, a lot of the time removing tumor in other cancers that not actually prevent recurrence, because those cells that are metastatic usually already elsewhere in a dormant state, so disease recurs regardless. So we need to have a lot more evidence that this is something that is really crucial to disease progression before, as Dr. Dilling said, undergoing a major surgery.
Yeah, certainly difficult conversations between patients and clinicians to wrestle with these decisions. Okay, let's see. We are winding down. You know what? I think we need to do this again very soon. And I would love to hear from each of you about what, as specifically as you can, what you are most excited about in the near term in terms of advancements related to LAM research or LAM clinical care. And maybe we can begin with Dr. Holtz and go back the other way.
I'm most excited about the possibility of new therapies on the horizon, and now with some of the work that Dr. Priolo described in terms of identifying new biomarkers where we can actually study the effectiveness of these drugs much better. I think we have a real chance of finding what else we can add to the toolbox to make the progression of this disease a lot more manageable.
Excellent. You're on mute, Dr. Dilling.
I will declare my bias first and say that I'm part of a working group of researchers that are looking at this, but including Caroline LaPoule here in Chicago. But the idea that immunotherapies, which might include using one's own T cells or some modified version of a T cell from someone else to attack a LAM cells, and just as it's being used in some forms of cancer, is very interesting and hopeful, although we have to make sure that before we start thinking about introducing it to patients that we understand that it's likely to be effective and that it's likely to be safe. And there's a lot of work that needs to be done before we're ready to get to that point. But somewhere on the horizon, I hope for that as a potential therapy.
Excellent. Yes, we also heard a presentation last weekend in Washington, D.C. with Dr. Lisa Hensky with some, she's excited about that as well. And Dr. Priolo?
Yes, I feel like repeating Marina and Dan, but what I like to see the future of LAM like a triad of achievements. So I think like better diagnostics, and I think in addition to our study, there are so many other biomarker studies that are being done that I'm really hopeful for. From the NHLBI, I think we heard last weekend from Martha Chen and Adrienne Campbell about like low dose CT, low field MRI. So these are all techniques that will be able to improve current clinical trials and LAM monitoring. But also in terms of additional therapeutics. And so the single cell RNA-seq, as we say, is really providing a lot of new insights. And so the LAM environment, you're all very excited about the potential of immunotherapy and all different immune cell types that can be actually targeted, from macrophages, T cells, and so on. So there are potentially several approaches that can be tested, which is absolutely a positive and amazing. But also other cell types that we're learning about, like the lymphatic cell. Now we know much more about lymphatic vessel endothelial cells and vascular endothelial cells and lung fibroblasts. So now we know much more about the lung environment. I think that's absolutely powerful for identifying novel therapeutics. And I think I want to also say something like the improved quality of life. That would be the third leg of the stool, right? As Dan mentioned, diet, exercise are probably not the cure, but definitely improve the quality of life. And I think the studies that Marianne Brown has been doing, the LAM feeds, I think that could actually raise the bar for this type of not treatment, but intervention. So all hopeful. We're all working relentlessly to improve the lives of women with LAM.
Excellent. Thank you. Well, we're just a few minutes over the hour. I want to say thank you to Dr. Priolo, Dr. Holtz, and Dr. Dilling for joining us tonight. I certainly heard some themes about how we're advancing on many fronts that are helping to move everything forward faster. The importance of quality of life, finding the new biomarkers to get to these therapies, new areas of study that have been funded by the foundation and others, as well as the simultaneous support and interaction by the LAM community for each other, and keeping this information flowing. So the research progress, scientific commitment, and patient courage to participate really is what makes the whole thing work together. I also personally want to thank all of our donors today. I know that we are working steadily toward our goal of reaching the 500,000. We're not quite there yet. So if you know friends and family who are still interested in giving, there are a few matches out there. And I want to thank our board of directors, the LAM Foundation staff who has worked tirelessly for the last couple of weeks to put today together and this important research campaign. And every dollar raised will go to the exact kind of projects that we heard about tonight. I'd also love to hear from everyone who's been on the calls. Send us some emails while you're thinking about it very quickly. What do you like about this format? What do you like about how we bring our scientists together? What would be helpful for you? We always hear that knowing what's going on in detail, how is the research money that we raise being used, and what results are coming out of that is vitally important. So we want to meet your needs in doing that well. So I also need to thank our sponsor for tonight, the National Disease Research Interchange, NDRI, who is instrumental in helping us get those important tissues into our research labs. So thank you so much for joining us for the virtual cocktail hour prior to tonight and our LAM Science panel discussion. And I offer my immense gratitude to everyone for making this community as special and effective as it is. Thank you, and hope to see you at the next Symposium. Good night.
Thank you. Thanks.